When looking into the day-to-day operations of a technologist or a technician in a hospital or any other healthcare setting, their duties tend to be fairly similar but can range depending on the setting of healthcare or field that they're in. So starting with cardiovascular technologists, their duties tend to be in aiding physicians in identifying conditions in the heart, in the lungs, and surrounding blood vessels. They deal with operating complex machinery and running tests such as EKGs, and they can also help physicians and cardiologists in implanting pacemakers or stents, or even emergency care when a patient goes into cardiac arrest. Next is the surgical technologist. They don't have quite as much patient interaction, but they do prep the OR room, make sure everything is sterile. They make sure they have proper PPE in the OR, and they could even help during surgery, holding clamps or implanting sponges, and they just make sure all the operations in the operation room are running smoothly. Next, the medical technologist. These people help collect samples of urine, blood, anything like that, and can run tests to see if there are any conditions or diseases in a patient. They run pretty complex machinery that can test these different samples that are collected, but they are the ones that are collecting the samples from the patients and then running the tests, but they don't really analyze the tests as much. Next is the clinical lab technicians. These people have almost no patient interaction. They're just given the samples, and they're the ones that run tests, use microscopes and cell counters on different blood and urine and body fluid samples, and determine if there's an illness or a pre-existing condition or underlying problem in a patient, or to clear a patient. And finally, the phlebotomy technician. These technicians only deal really with blood, so they're helping collect blood for a patient, whether that be drawing blood or doing transfusions or running it through microcollection, any sort of thing dealing with blood. That's what the phlebotomist technicians will do. And they can also assemble equipment and prepare blood collected for a transfusion or donation, anything along those lines. So those are the general duties of each technician or technologist. They're normally helping out a doctor or nurse that's a little higher up and helping in some of the smaller, more technical operations in the day-to-day works of the healthcare system.